Well, hey, Susan, thank you so much for inviting me to speak today for Assisi Animal Health. And to everyone who's out there in Zoom land, thank you so much for taking the time to spend a little bit of your day with us. And hopefully we can make it worthwhile with a relatively simple review of many of the options that you have nowadays for treating osteoarthritic pain in both dogs and cats. I'm coming to you today live from the Oswald Underground Studios, part of WIVS in Clearwater, Florida. So hopefully you guys are having a nice day wherever you are as well. I have a couple financial disclosures. I am a consultant for Assisi Animal Health, as well as several other companies that don't have any relevance for this talk today. You'll notice that I'm a diplomat of the American College of Veterinary Internal Medicine. So you may wonder, why would Gary be giving a talk on osteoarthritis? Well, osteoarthritis has been something that's been on the forefront of my mind, both as a veterinarian and as a person for decades. Why is that? I think two things. I recognized fairly early, over 2 decades ago, early into my career as an internist, that osteoarthritic animals, it is a systemic disease. There are systemic consequences to having pain that is a constant in your life, day in and day out. And early in my career, many times I tried to pawn off arthritis cases, especially when NSAIDs became such a new and hot topic for us in veterinary medicine. I was always trying to pawn off patients that had arthritis to other specialists. And what I found was, in reality, that general practitioners and internal medicine specialists are probably both in the best position to manage patients, because again, arthritis needs to have a look at the entire body and the consequences on it. And the second thing, about the same time, I started having problems from an old baseball injury when I was in college that derailed my relatively underwhelming collegiate career. So I finally figured that veterinary medicine was better than baseball for me to make a living. But I had some serious knee surgeries and wrist surgery from an accident in the outfield. And, 20 years later, sure enough, osteoarthritis caught up to me in both of those joints. And it took on a special meaning as to, how I wanted to help patients that had this problem from a pet perspective. Okay, well, we'll start off with all presentations have to have some sort of a cat meme. And here's today's, the most interesting cat in the world. And you can see when this cat doesn't fall often, but when it does, it lands on its feet. I wish the same had happened to me back when I was a 20-year-old kid. So let's start with just a couple of real brief definitions. Osteoarthritis, we're all very familiar as veterinarians with this disease process. Again, it can either involve one or multiple joints within the body. It can be caused by a variety of different insults, either trauma, aging, again, that affect either one or multiple joints. And there are various things that occur within those joints. We see that loss of the proteoglycans and collagen lining of the synovial cavity that exposes subchondral bone, which then becomes eroded, inflamed, and you have that bone-on-bone contact, which stimulates not only inflammation, but nerve endings and pain. Thus, we get this chronic, ongoing, day in, day out inflammatory response that's involving the synovial tissues and that subchondral bone. And over time, pain itself is there to protect you. But when you start experiencing pain on a routine, constant level, it becomes maladaptive. We start to recognize, in many studies now that pain begins to desensitize the central aspects of the nervous system. And oftentimes what should not be perceived as a horribly painful experience can be amplified. And again, it's chronic, and it becomes not only painful, but a disability disorder to our patients. And again, it probably, in surveys that are done, at least from both looking at clinical signs and radiographic changes, 80 to 90% of our geriatric dogs and cats have some evidence that they have osteoarthritis. So it's certainly something you see, day in, day out in your practice. And again, that chronic pain relates to systemic signs. we as veterinarians, it's obvious to us when a patient is in pain, I think, and watching how they walk and move with arthritis, that either obvious lameness involving one or multiple joints. Many of our patients are very stiff. They may have reluctance to get around in our exam room. Owners may be able to relate to us that reluctance or hesitancy in jumping up and down at home. In many cases, problems with going up and down stairs at home, and especially for cats, problems getting in and out of the litter box, especially high-lipped litter boxes. But beyond just those obvious clinical signs that we might see in our office or an owner may experience at home, there's a lot, again, as I said, it's a systemic issue. These patients have reduced activity. They oftentimes spend a lot more time resting or sleeping. They oftentimes sleep in areas or rest in areas that are much easier to access for them compared to normal places. They have a lot of reduced interaction with other animals in the household, with people. Maybe it's, again, a grumpiness like you see here with grumpy cat and grumpy dog. Altered grooming is a big thing, especially in cats. We just don't see them oftentimes wanting or being able to groom certain areas of the body. And then on the other hand, if they can get to certain joints, oftentimes they'll overgroom around those areas. And dogs will do the same, where they can develop, significant hair loss or lip granulomas over areas of joint pain. Overgrown toenails or claws are a very common thing in arthritic patients as well. And then just on top of that, they're just not the pets. They're not living the quality of life that they deserve and that we're used to. A lot of temperament changes, these irritable, grumpy animals, especially when they maybe are picked up or disrupted from sleep. And again, they become loners. They oftentimes avoid those interactions that make it so enjoyable for us to have pets. There's so many resources out there right now, and I just point because Assisi Animal Health is with us today. If you were to go on their website, they have a very nice website, and one of the pages that's categorized is, again, looking at cats that are masters at hiding pain. So they have some nice handouts. There's many things on the internet that you can direct your clients to, oftentimes to help pick up on, signs of early arthritis, which is where we really want to catch this disease, because it'll certainly enhance our ability to treat it. Now, that said, let's get into treatment of arthritis that we're here to talk about today. So it's a multimodal approach. When NSAIDs first came out, I was in practice, private practice at the time that Rimadyl first hit the market as the first FDA-approved, non-steroidal anti-inflammatory in veterinary medicine. And when those drugs came out, it was a godsend to us because we didn't have very effective pain control medications prior to that time. However, the downside of that, or the flip side of that, is that for many of us, it became the only therapeutic that we looked at to manage patients that had chronic arthritic pain. So we will talk about NSAIDs and their ability to reduce inflammation and pain and maybe where they fit in the scheme, but they are not the one and only thing. Again, we need a multimodal approach to osteoarthritis. So we'll talk this afternoon about chondroprotectants, nutraceuticals. We're going to talk about some ancillary treatments and devices that are non-drug categorized. And again, we'll talk about some things such as weight loss, modifying the environment, things that are common sense principles that we oftentimes don't think about. And again, I can tell you that in my arthritic situation, until I started getting exercise, losing weight, getting more mobility, more strength back in, this wrist and this knee, NSAIDs were not cutting it. They gave me some temporary pain relief, but they didn't provide that flexibility and that strengthening that we need in order to really live quality life with arthritis. The other thing we want to focus a little bit on today is that we said a lot of our patients that as they get older develop degenerative arthritis. Remember that older patients have older organs, and we want to be careful. Aging is a biologic process. It affects all the body systems, but especially things like the kidneys, the liver, the cardiovascular system, the neuromuscular system. All of these may have diminished functional reserves in our patients that need to be taken into account when we think about drug therapy. Drug absorption, distribution, eliminations can all be altered, especially with chronic drug administrations to older patients. And again, as we all know, our first goal as doctors is first, do no harm. If we're going to give a chronic medication on an ongoing basis, we need to be aware that there may be other things that we can add to that drug that may either lessen its use or potentially discontinue its use altogether. The last thing I want to make sure we talk about today is we're talking about both dogs and cats. And when it comes to cats, I think we're all aware, painfully aware sometimes, that they're not little dogs. There's an inherent difficulty of giving them oral medications. Oftentimes giving multiple medications, polypharmacy, if you will, can be very difficult when it comes to the effect on feline behavior, appetite, their interactions with us. I mean, sometimes I worry our patients hate us. And the things we ask owners to do, those poor pets hate their owners. I apologize. I've got a lawn service going to be going by my window here in a second if you hear a little bit of noise. Cats also sometimes metabolize drugs differently than dogs. And a big factor in older cats is that many of those patients have, most of those patients have concurrent kidney disease, and that could be an issue for those. All right, we'll give him 1 second to clean out my front door well. And he's hopefully done right about now. All right, guys. So as far as what we want to do with multimodal osteoarthritis treatment, let's start from simple things that we should start immediately when we recognize that there's a problem with a patient with arthritis. I think he's finally moving away. We want to look at the environment. We want owners to look at their environment carefully and modify it. We want it easier for pets to get around the house, easier access to look out the window or get into that windowsill, easier access to be able to get up on furniture or the couch if we allow that in our homes, easier access to food and water bowls. When you look at this thing up here, it looks really cool to make your cat walk up the wall on these little planks to get to their food and water, but maybe not such a great, cool idea if you have osteoarthritis. Yet the same principle, a ramp going up to a bed for this collection of old Yorkies is a wonderful thing for them to get up and down. Easier access to the litter box. Again, these high litter boxes for cats are difficult for them to step over or step into, especially if you've got the enclosed model. So again, getting ones that have lower entry and exit lips, much, much preferred by cats. Heated beds, again, just giving our patients a spot. I know in our house, I've got two older cats and one younger one now. But when we allow them to, in the wintertime, get close to the fire and get heated beds, they absolutely love that. Second thing we'll talk about, again, a principle that we sometimes forget is that as long as you're overweight, and statistics tell us that over half the dogs we see are overweight, and we're approaching that number in cats now as well in surveys. But the heavier you are, it's common sense. You're putting more load and more stress on those peripheral joints. And that not only is painful, but it potentiates the development of more inflammation, more bone-on-bone rubbing and contact. And these patients are going to be clinically worse. So anything that we can do. And there's one interesting study that showed that in Labradors, when they did a colony of Labradors and followed them, from birth to death, the dogs that had a restricted feeding by schedule, so that they could, fairly closely regulate what their caloric intake was, did a lot better as far as less osteoarthritic development compared to dogs that were fed ad lib and allowed to become overweight. So again, trying to keep weight down. And one thing I tell owners all the time, because you tell me, you guys are in private practice like I've been for 30 plus years. Clients, whether they have money or they don't have money, they always complain about it. That's just the nature of the beast. So one of the things I love about osteoarthritis talks is when I tell the client, hey, today I can save you money because your dog or cat needs to lose weight for that arthritis to get better. And that's easy and cheap because you don't have to spend as much money in food or medications. It's just paying more attention to calories in and activity levels for these patients. So again, I won't go through a whole lot about, weight loss. You guys know enough about that, but getting a good program in, and it makes sense to people when they hear it's free and it's saving them money. Oh my God. That's the best way to, I think, approach weight loss with so many clients, but get on a program that hopefully allows that pet to get back down to some form of a lean weight, and then increase activity along with caloric restrictions. So more walks, they're free. Maybe going out for us in Florida in the pool if your dog or cat enjoys that, it's free. Playing laser or toy chasing and birds on a feather or on a string and mouse on a string for cats. All of those things are free for owners to do to encourage that weight loss. If they need to, there's plenty of people out there that have other initials after their names. I'm sure many of you guys in private practice and general practice have the ability to do physical therapy as well and rehabilitation. But all of that, if we can get out and get moving, it restores strength, the muscles and those supportive periarticular tissues. You get better range of motion, and that is so key to getting patients up and moving. Their endurance becomes better, flexibility, balance, all of the things that, again, for dogs and cats are quality of life issues. And again, underwater treadmills, swimming in pools, great things. Massage therapy. Look at this cat here. I have a little yellow older man like this. Finster's my guy. You tell me that cat doesn't enjoy what's going on right there, and it didn't cost a nickel. So good things to do. Also, don't forget about medical assist devices. We use them all the time in people, but yet I don't see that much use in veterinary medicine. And again, they are inexpensive and things that owners can basically take ownership of at home, but either non-slip booties for traction, the assisted lift devices for abdominal lifting to help, especially heavier dogs getting up and down stairs or in and out of the car. Any kind of decompression bandages or the actual soft splints that can be put on individual joints can certainly help animals with that stability and that ability to become mobile and utilize injured joints or osteoarthritic joints as well. So these are all simple things that I think we sometimes as doctors overlook because we're so hot to get to things that we can prescribe. But let's not forget about weight loss, activity, exercise, and assisted devices in that regard. Now, let's talk a little bit about the things that we do prescribe. Let's get a little bit of an overview on where they fit into the program. So again, the more that you can get a patient up and moving and losing weight, hopefully the less reliance you're going to have, especially on some of the more serious drugs. Chondroprotectants are I think, an interesting field. These are nutraceuticals. So again, they're not regulated drugs that are there to either maintain or possibly improve joint health. And chondroprotectants, we're all aware, glucosamine, chondroitin, hyaluronic acid are there to improve the characteristics of joints like the elasticity, hopefully help improve synovial fluid production, as well as restore tissue, maybe slow cartilage degeneration down so that our knee doesn't end up looking terrible like the subchondral bone erosion you see here. But the key thing to chondroprotectants, they probably don't do squat when you get them done late in the disease. You need to initiate these kind of supplements early in the osteoarthritic process. And there will be a delay. You will not see an immediate response. Like when you give an NSAID, the patient might be better within hours. When you start chondroprotectants, you have to make sure that you and the owner are aware that honestly, it could be several months before you really recognize any change in that patient's mobility. So these are things to initiate early, along with that weight loss, that increase activity levels to, again, try to maintain joints. You have a variety of different products out there that contain these glycosamine glycans or GAGs. Again, those are glycosamine hydrochloride, chondroitin sulfate, hyaluronic acid. They come, as we're aware, of both oral formulations, where you can either give them as a tablet or capsule form or administer them on top of or within food. They also come, obviously, we know, like Adequan in an injectable form, where they can be given at regular intervals to try to boost these nutraceutical levels within the joints. Where I would put chondroprotectants, honestly, and I took glucosamine chondroitin for years, and I could never tell if it made a big difference to me or not. I think I probably started it relatively later in joint damage. But this I would put in a category of they may help certain patients, They certainly don't hurt. There's virtually no side effects to these sort of products. So again, might help, won't hurt, certainly worth a try. Start them early though, that's the key. And again, give them at least, probably a 2 to 3 month period of time before you really pass any critical judgment as to whether these sort of products are making a difference or not. I'm certainly not as high on chondroprotectants, I think, as I once was, or the field once was. I think, again, with the advent of a lot of more advanced therapy nowadays, unless we start these things early, again, getting them late just may not play much of a role. Now, there's also nutraceuticals that are designed to not so much restore the joint, but reduce inflammation and reduce pain. And these nutraceuticals are anti-inflammatory. And we think of things like omega-3 fatty acids, green-lipped mussel extracts, which combine both glucosamine chondroitin high levels with omega-3s. Microlactins, one you may or may not be aware of, I'll review real briefly. And then another one called undenatured type 2 collagen. These are all nutraceuticals that are easily available to us, readily available to us, that again can provide some reduction in joint inflammation and pain. I think we're all very well aware of omega-3 fatty acids. They play a role in many different diseases, but they really do play a significant role in arthritis. I can tell you that I take a newer omega-3 fatty acid now that is called Visipa, which is designed for people to help lower lipid levels as well, which I have high triglycerides. And now that I'm on this genetically engineered Visipa drug, I can tell the difference in my joints as well. They are much better than they used to be on just over-the-counter fish oil. So again, reducing arachidonic acid, these inflammatory cytokines that are released into the joint, it's a local way to improve the hemodynamics of your joints. And they certainly have protective abilities on lots of other organs, especially in older patients like the kidneys. So if we're not on an omega-3 fatty acid, or there's not one that's in maybe a diet already that we're feeding, if an older patient might be on a kidney diet, again, some of the therapeutic diets already contain adequate levels of these. If not, we can certainly give them as an oral over-the-counter, I would tend to say veterinary product. I think it's better to support our veterinary manufacturers. We know what we're getting. Green lip mussels come in a lot of different dog treats. And again, they combine this nice high omega-3 fatty acid with the glucosamine chondroitin content. And again, in some ways, you're getting the benefit of both of those substances potentially locally, for those joints to reduce inflammation and hopefully reduce pain. I mentioned microlactin. It's a concentrated milk protein. It became very popular in Europe, specifically Switzerland, several decades ago. They're able to get this milk protein from dairy products, hyperimmunized cows. And it's a non-specific inhibitor. It has a different mechanism of action than non-steroidals or steroids would. But it inhibits inflammation by basically blocking local cytokines, and it reduces neutrophil and macrophage migration and adhesion to affected tissues. So again, if you take it as with osteoarthritis, it's going to hopefully help reduce inflammation in those joints. What are hyperimmunized cows? This is the best I could get for you. I Googled it. And I think if you look closely, a couple of those cows, look at that one right there, they are definitely hyper, if not immunized. And again, this sort of product very safe on other organ systems that we might have concern with in older patients. How about in the veterinary field? We do have microlactin. Actually, there's a product called Duralactin. And what I really like about Duralactin is you can get the plus Duralactin or Duralactin plus. And that actually, again, combines microlactin with omega-3 fatty acids. So you're getting the best of both of those worlds giving that. And in many of the patients, or at least the one clinical study that's published, there were clinical effects seen in some patients in as short as 1 week's time period that showed they were, had some improvement in their joint function. The last one of the nutraceuticals, undenatured type 2 collagen. Again, the thought process here, this is a product made out of chicken collagen. I believe it's specifically the sternum of the chicken. And that type of collagen, undenatured type 2, basically stimulates the gastrointestinal immune system, and the immune system recognizes that and becomes tolerant to it. And this tolerance then is hopefully able to be transferred to what's going on within the patient's joints, where hopefully the immune system becomes somewhat tolerant then of the fact that we're getting this degradation and disease of collagen, and hopefully doesn't attack that collagen as aggressively as it had been in the past. There have been some limited studies in dogs using undenatured type 2 collagen, and they certainly suggest that this sort of anti-inflammatory response can potentially be better or on par with what you might see with glucocorticoids or NSAIDs. So again, something to think about. It comes in a treat, and so certainly might as well take advantage if owners are going to give their dogs or cats treats to use things like this type of nutraceuticals, Duralactin, again, any of the green lip mussels, the type 2 collagens. All of these things can only hopefully provide some benefit to them. So again, treat early with any of these type of things, but also treat adjunctively, even in advanced cases, because there is this anti-inflammatory effect. Now, we also have prescription drugs that can do that. Let's state this right off the bat, that there's no reason to really be using glucocorticoids for degenerative arthritises. We certainly use them sometimes, or not sometimes, but we do use them for immune-mediated arthritises, which are the most or more uncommon type that we would see in dogs and especially in cats. Glucocorticoids actually can potentiate and create worsening of joint disease. Non-steroidal anti-inflammatories, however, really are the cornerstone therapy for reducing significant inflammation in dogs, and certainly to some degree off-label in cats. So if you have a dog or a cat who is doing all the things we've already mentioned, is maybe on some of these nutraceutical products, has been attempting to lose weight, has been more active, is receiving activity or even physical therapy, and they're still not getting over the hump. They're still painful. There's still some obvious direct lamenesses, temperament changes, whatever their either local or systemic feelings are because of arthritis. Non-steroidals have the benefit of being able to almost immediately reduce pain. They can provide a very measurable response quite quickly after administration. Thus, they become a favorite. And plus, we've all grown up in the area of over-the-counter anti-inflammatories in people, where we know how easy it is when anything in our body hurts just to go pop an Advil, pop a ibuprofen, something that will give you some relief in a fairly short time period. But remember, there can be a trade-off to these kind of drugs, and that is that they affect prostaglandins, not only in the anti-arthritic process, but in the gastrointestinal tract, in the kidneys. These drugs are metabolized in the liver. High drug levels of these drugs can certainly be a problem for kidneys, for gastrointestinal ulceration. Even they can have some significant effects on coagulation parameters. So while they're the cornerstone of therapy, and for years, for so many of us, they were the only therapy we were giving because it was just easy to give a bottle of Rimadyl and not have a discussion about all the other things we've already mentioned today. We have to be careful that, the chronic daily use in some of our patients can promote other problems. So again, these drugs should always be looked at carefully. And our goal should always be to use the lowest effective dose and possibly spreading out to the, least frequent interval that still provides the desired effect for that patient. So the bottom line is just be careful with NSAIDs. We've got lots of them on the market. Since I put this slide together, there's probably more that have been introduced. I would simply say as veterinarians, we should try hard to stay away in our pets from the over-the-counter aspirins, acetaminophen, ibuprofens, just because of the potential for abuse and then the side effects in dogs and potentially death and toxicity in cats. But again, any of these drugs are fine. I have never really had a favorite, to be honest with you. I would simply say to you that you use what seems to work in an individual patient. And just like other drugs, if one doesn't work, use another one. And in today's day of age, you don't have to carry all of those drugs in your pharmacy, through Chewy.com and other online pharmacies. I know there's lots of reasons that we don't like to use them, but one of the advantages is it's easy to try different drugs if one doesn't work, that we don't have to carry them all in our offices. Now, what about cats with arthritis? Dogs, for the most part, these drugs are well accepted, although, again, as I already mentioned, they can have some significant liver, GI, and kidney issues in some patients. Because so many cats get chronic arthritis as they get older, is there a problem with these type of drugs in older cats with arthritis? The good news is that although they're off-label use in the United States for arthritic treatment, and especially for long-term arthritic treatment, the evidence we currently have that comes out of other countries, Australia, Europe, Canada, and even in publications, tells us that when we dose these drugs appropriately, they can be used on an ongoing basis in cats. Now, again, our goal is to use them at the lowest dose and the lowest frequency possible, but they can be used at these lower dosages you see here. Meloxicam at this 0.025 to 0.05 milligram per kilogram dose, and robenacoxib starting at 1 milligram per kilogram, no more than 2 milligrams per kilogram per day. Again, make sure in cats, especially if they have concurrent kidney disease, be sure those cats are feeling good, otherwise eating good, drinking good. Dehydration is our clinical enemy in cats. And if you're on NSAIDs and get dehydrated in the feline species, you certainly can create acute on chronic kidney disease very rapidly. But the bottom line is we can use these drugs if we need to for either breakthrough pain or in patients that do require them on a long-term basis. There's a few other things we can do drug-wise that can block neuropathic pain. Remember, I said early on that part of osteoarthritis is a systemic disease. And when you have chronic pain every day from inflamed joints, over time, this neuroinflammatory response that goes from the joint to the spinal cord to the brain, and we have some response to that, becomes maladaptive. And we live, unfortunately, in this geared up chronic pain state all of the time. It's called central sensitization or hyperalgesia or allodynia. And we want to get away from that. We want to centrally desensitize these patients so that they're not having an overreaction to what, again, shouldn't necessarily be as painful of a stimulus as they are acting day in, day out. There are both narcotic and non-narcotic drugs that we can use in these patients. And again, we should consider using some of these drugs if we need to either supplement the other treatments we've already mentioned today, especially the nutraceuticals and NSAIDs, or in cases if we can't use NSAIDs because of other organ issues, we certainly want to lean heavier then on these type of drugs, Gabapentin, Amantadine. I'll briefly mention the drug is not available in the US right now, the anti-nerve growth factor, MABs, and we'll briefly talk about tramadol and other narcotics. So gabapentin is an interesting drug. We certainly know that it desensitizes nerves. Basically, it is able to inhibit calcium influx in the dorsal horn of the spinal cord, which is where most pain transmission occurs from the local tissues to the spinal cord and brain. It's able to basically inhibit that excitatory path or those neurotransmitters like substance P and glutamine and norepinephrine. And thus our brain doesn't get as much input. The question I think becomes is gabapentin really a sedative? We certainly know it works very well to sedate cats prior to veterinary visits. It can be used somewhat as a sedative in dogs as well. Or is it really an effective pain medication? Do we see relief because of the sedative effect or the pain response? And the answer is we don't know for sure. We don't have a lot of studies so far that are critical studies that investigate, at least in dogs and cats, the pain modulating properties of gabapentin. We do believe they occur. So it's certainly something that I would anticipate continuing to use in veterinary medicine as these studies develop. The good news is that although it's a predominantly renal cleared drug, we don't have a lot of issues with high levels developing within the body that create other problems. It's a relatively safe drug with a very wide dosing margin. The bioavailability of gabapentin is somewhat variable, and it has a very short half-life. So as you see, the doses generally start somewhere around 5 milligrams per kilogram, probably 3 times a day in dogs, and 3 milligrams per kilogram, probably twice a day in cats. But as you can see, the dosages over time oftentimes need to be escalated into the 20 milligram per kilogram range or higher in order to get the effects you're looking for from pain relief or sedation with this drug. So again, it's a patient-specific dosing, and you, with communication with your client, have to decide whether you're seeing a benefit from the drug at a certain dose schedule or whether we're willing to increase, and that increase probably occurs every several weeks until you fall into what you feel is a beneficial dose range on a consistent basis. Again, sedation, ataxia would be the limiting effect. So if you start seeing that the patient is overly sedated or ataxic, we probably have hit the ceiling level, and either the drug is helping us and we can back off a little bit, or it's time to ditch it and move into something different. Be aware that the commercial solution here, the oral solution of gabapentin, the human generic, does contain xylitol. We all know that can be a toxin to dogs, but not cats. But if you are giving it to small dogs, it's probably better to have it compounded at a veterinary pharmacy. Be very aware that gabapentin, again, the oral human generic, contains xylitol. Amantadine is another drug that can be used similar to gabapentin if gabapentin is not effective, or it can be combined with gabapentin for an additive effect. Again, trying to desensitize this central aspect of pain. It's an NMDA antagonist. So again, it basically blocks some of the transmission of these painful impulses in the spinal cord and the neurologic tissues. You've got a dose there, a fairly limited range dose for amantadine, 3 to 5 milligrams per kilogram, generally starting once a day and then increasing to twice a day if necessary. This is a drug that initially in some literature gets a bad rap about a narrow therapeutic window and side effects. They describe anxiety, restlessness, dry mouth, diarrhea. Honestly, myself and most colleagues that I talk to in the pain control world feel that that is a bad rap, that this drug is relatively safe, and we don't tend to see a lot of those effects. So be aware of them, be on the lookout for them, but I wouldn't not use amantadine because of that concern. Again, this drug has very high bioavailability, and thus part of the reason why we don't have to change the dose anywhere near to the degree that you have to potentially mess with gabapentin. Okay, so again, bottom line is all of those drugs can be used. We can use nutraceuticals, we can use NSAIDs, we can use gabapentin, amantadine, if necessary, together in some patients for a multimodal effect. Again, may not be the best thing for cats because they don't like lots of drugs. But again, this is all the ways that you have to look at what works best to give that patient pain relief. You're going to get inundated coming up, if you haven't already, in your inboxes about anti-nerve growth factor monoclonal antibodies. So these are called MABs, monoclonal antibodies. And basically this is a specific species-specific one. So it's either made for dogs, it's also been investigated for cats, where you can basically produce an anti-nerve growth factor antibody, which will stop nerve growth factor transmission or effects within the body. This is a big player, they think, in inflammation within joints. And if we can go ahead and, again, have another target to slow down or stop inflammation, it may be beneficial in arthritic relief. This has already been approved as Librela from Zoetis in Europe. It's called Bedinvetimab. I'm not probably butchering that name. I hate the MABs because they all have hard names to say. There's a different one for cats. It's not so far commercially available, but has been investigated. Bottom line is they act locally and they don't have effects on other kidney or other organs like kidneys, livers, hearts. And so there's some degree of hopeful safety with these. So be aware you're going to hear a lot more about that. My guess is FDA approval is probably somewhere within 2021 for an anti-nerve growth factor monoclonal antibody product in dogs in the US. One of the interesting things about it, it's not given orally. Cats might like this someday if they can derive it in cats. It's given, at least this drug, Librela, as a once-a-month injection in order to fight in order to fight osteoarthritic signs. There's an interesting paper, if you're interested, Dr. Enomoto published in Vet Record in 2019 January, reviewing the several studies. There's only 2 studies really in dogs to this point that have been published, but they review those and talk about the theoretical benefits. Be a little bit careful, because anytime something new comes out, it's like the best thing this side of the earth to the manufacturers, and they're going to push this sort of thing heavily to you. Like anything else, a time course has to go by until we really understand what the beneficial effects, what the potential side effects will be of this sort of a product. But again, it's going to at least be one more thing to put into your armamentarium for anti-arthritic control. Let's briefly talk about narcotics and where they fit in. You know what? Honestly, in chronic arthritis, they don't fit in very well. Tramadol, which we certainly had high hopes for as a opioid mu1 receptor agonist, really has not panned out in canine medicine to be a very effective drug. Probably it does not do a lot of mu1 receptor activity. That any pain relief factors we get are probably more from its serotonin and norepinephrine blockage. Unfortunately, it's a drug that's widely used for pain in dogs. I don't think you get much pain relief from it. I think oftentimes it's more of a placebo effect. I won't even go over the dosages that are proposed to you. I certainly would never use it as a standalone drug. I think it should be, again, part of a multimodal pain management, and I don't expect too much out of tramadol. The writing's been on the wall for some time in the publications regarding this drug in veterinary medicine. In cats, it's got a little bit better bioavailability and probably does stimulate the mu1 the receptor better for narcotic effects, but cats absolutely freaking hate this drug. They will not take it from the taste. They get dysphoric. They stop eating. Many of them get GI side effects. So bottom line is, again, tramadol, for me at least, is really not part of my mainstream pain relief, proper pain relief protocols chronically for dogs and cats. There's a lot of other narcotics that you could give orally on the market. All of them are probably better to be used only for acute breakthrough pain for a couple of days at best if you needed them. But I would not get into, again, the benefits of chronic narcotics. You see all the problems with people, behavioral changes. Animals do become reliant on them over time, and they're just not something that provide us that good of a benefit in a chronic situation. If I had to give something for breakthrough pain, if I had a patient with a single joint that really went bad and was painful for a few days, in addition to my NSAIDs, I would probably use buprenorphine in those patients, either injectably or transmucosally as a way to, or transbucally as a way to, go ahead and relieve pain in a dog or a cat for just a couple of days at a time. So again, the more we stay away from narcotics, obviously from a chronic outpatient use for a variety of reasons, the better. All right, guys, let's spend the last minutes that we have today, about 15 minutes, on some non-traditional things that also, for patients that either we want to reduce dosages of NSAIDs, or we don't want to get into Gabapentins and Amantadines, and we don't want to get into narcotics, what else can we use to help these patients that have osteoarthritic pain? What else can we do to relieve that? One of the ones that's interesting, and this is something that's done by our sponsor today, Assisi Animal Health, is to reduce inflammation and pain through the use of pulsed electromagnetic field therapy, or PEMF. They've known about pulsed electromagnetic fields for over 2 centuries, going back to the early 1800s. In the last 70 years, there's been a medical interest in using pulsed electromagnetic field to basically do things to the tissues within the body. That sort of signal influences calcium and nitrous oxide in whatever tissues you might target. And through its use, it hopefully changes some cellular metabolism, modulates inflammation, reduces pain transduction, helps with tissue growth and repair, gene expression, and some other physiologic processes. So again, it's an interesting concept that we could expose a tissue to electromagnetic field, and through the changes in those tissues, hopefully help promote health and healing. There's numerous studies in people, and well, it's been used in arthritis and for other conditions. And we do now have some evidence, some decent published evidence-based medicine in veterinary medicine, talking about its use for pain relief in intervertebral disc disease. There's actually 2 papers here. You see one of them in 2019, the effective targeted pulse electromagnetic field therapy on postoperative hemilaminectomy patients, showing that they recovered better and were less painful compared to patients that didn't receive these treatments. What I really like about this, and the reason why I've agreed to speak with Assisi, is number one, it's home therapy. It's something that can be done by the owner at home, where again, they've got ownership of it. They can give the treatments. The benefits they see are good for not only the pet, but it's good for them. And anything we can do to have people be able to deliver things at home are wonderful. Number 2, it's drug-free and it's non-invasive. There's no sticking, prodding, there's no pill administration. The patients are accepting of this therapy much more readily. And thus, I think if they're going to take it, compliance, right, they're going to hopefully benefit from it as well. There's really been no adverse effects over all of this time in the last 70 years in the human or veterinary experience with pulsed electron or electromagnetic field therapy. And again, the key thing is, used as part of a multimodal program, it may reduce the dependence on some of these other therapies we already talked about. So if you can get a patient to lose some weight, get on some anti-inflammatory nutraceuticals, use NSAIDs as needed, yes or no to some of the other drugs we've already talked about, Gabapentin, Amantadine, depending on severity. But this fits in as something that can be done every day at home and targeted to the individual areas where the patient is painful. And we'll show you that in this product called the Loop. The Loop is something that you can either put over, I wish I had mine, I have one in the other room, I'm sorry I didn't bring it out, but you can put it over a specific joint, like my bad wrist joint, and treat that area specifically. And a dog or a cat, because of their size, the Loop comes in 2 different sizes. It can be placed over distal joints, carpus, elbow, tarsus, stifle. Look at that. Even an old internist still remembers those anatomic names. But it can also be placed with uses of a vest over vertebral units. It can be placed over hips, shoulder regions, neck, all kinds of places. And again, the same with cats. I treat my own cats with it. I have 2 of them that are over 16 now, and they definitely, I think, appreciate the fact that they are more mobile since we started using the product almost 1.5 years ago. This is something that is done in 15-minute sessions. And if you can get the patient to be petted and sit quietly and keep that loop over the area. The nice thing about the loop, I didn't mention this, I'm going to go back here a couple of slides. When you look at the loop, here it is in the middle of this slide, you can see that the pulsed electromagnetic field radiates out, almost 10 inches on either side of the middle of the loop. So again, putting a joint through there or putting it over a specific area of the body is going to allow that pulse electromagnetic field to penetrate those tissues and elicit those, hopefully, physiologic beneficial responses. So 15-minute sessions 2 to 4 times a day, initially for the first 2 to 4 weeks. And then you taper the treatment and you can use it in some patients as needed. What's really cool in cats is they have this thing called the Loop Lounge, where you can actually put 2 loops in a cat carrier, or you could do a cat bed at home. That's what I do with mine. And they've got 2 of them in their beds. And when they're sleeping, you turn them on and they get that almost whole body for a cat treatment that's delivered over that 15-minute period. So pretty cool innovation on the ways you can treat. But I love it because it's at home, no drugs, again, no pinching, no prodding, no fighting to get a pill in. And I think it complements these other therapies beautifully. What else do you have out there? Acupuncture. I've always been a proponent of acupuncture. I think it does help many osteoarthritic patients. Whether you do dry needling, aquapressure, electroacupuncture, I'm not familiar with all the different types, but basically that stimulation of those tissues hopefully elicits that neurohormonal response that reduces inflammation and pain. The only drawbacks to acupuncture is you got to go somewhere to get it done unless you're an acupuncturist. So it's an outpatient treatment that you have to travel to. It is drug-free, which is great. It's minimally invasive, but you're still sticking needles in there, which turns some clients off. Really no adverse effects unless I did it, because I'd probably stick it in the carotid artery or something stupid and create a problem. But in an experienced operator's hands, it's a very safe thing to do. And again, this may help reduce the reliance on other osteoarthritic therapies. Low level or cold laser therapy, this photobiomodulation treatment, if you will. Again, different form of therapy, but same type of principles here, that photons are absorbed by damaged tissues, activating mitochondrial RNA, hopefully then promoting the physiologic effects of healing, reducing pain and inflammation. And again, same principles. It's got to be an outpatient therapy. You're going to travel somewhere for it. Again, advantage, drug-free and non-invasive, I think is great. No real adverse effects. You do have to be cautious. They report over dark skin. You do get to wear the cool sunglasses, both you, the administrator, operator, and the pet, which is always kind of cool to get these little sunglasses, ultra cool kitty, cat, and dog pictures. But again, bottom line is it may be something, again, that affects certain patients better than others and piques interest in certain owners more than others, and can certainly be used, again, as a non-traditional, if you will, mode of therapy for these osteoarthritic patients. I'll be honest with you, I've never been that impressed with the results of laser in patients that I have had lasered within my own hospital. And again, it's just one of those things where I think it probably works. All of these therapies probably work better for some patients versus others. I've had cold laser therapies done for my knees and my wrist, and I haven't benefited from it. Maybe that skews me a little bit in my outlook for this. But again, I think other therapies certainly may have more promise. Stem cell therapy, platelet-rich plasma therapy for specific joints. You inject PRP versus stem cell for the whole body. Again, certainly may be some benefits. I think we need some more study in this field. The University of California, Davis, I know, is doing that currently. And, they have a regenerative medicine section. And hopefully within a few years, we'll really be able to understand what the benefit of this is. The problem, of course, right now is it's widely available, but it's invasive. So it's expensive. And again, the evidence out there is, like many of these things, equivocal at best. So I think at the present time, it's a good thing to consider. And some clients may gravitate towards this sort of therapy more than others. But the same thing is in people. Certain people believe they get a lot more response out of this therapy than others. Oh my God, you can't have a talk nowadays in veterinary medicine without talking about CBD. This dog just pops out of nowhere on my slides. There's a lot of proposed benefits to cannabinoid therapy, to CBD therapy, and some of it's certainly chronic pain, reducing inflammation and neurogenic analgesia effects. There's certainly some anti-anxiety, some improvement in appetite. They talk about less nausea, maybe an anticonvulsant effect. So there's lots of things that CBD is proposed to do for dogs and cats. My only big concern with it is there's certain things I'd like to see. And one is I'd like to see evidence-based studies in any of these types of therapies. And certainly I think we're just at our infancy in it. There's one that came out in 2018 out of Cornell that did talk about safety. They talked about dosing, at least of one specific product. They talked about maybe some of the efficacy seen for osteoarthritis in dogs in that paper. But we need to see more than one study. I mean, one study always is something that gives you hope that treatment will help, but it's not definitive. Safety, so far, again, the good news is there's been a lot of experience with use of CBD in the last few years with little toxicity. Question, of course, is does it provide benefit? We need to have somewhat of a regulated market with this. There's so many different products out there. It's hard to understand the strengths. It's hard to understand what's in certain ones. And there's still a lot of legality questions. So I'd like to see those cleared up before it becomes a mainstream therapy for me. I tell owners if they're interested in it, I don't bring it up to them. If they bring it up to me, I tell them certainly there are dosages out there that we can give them websites to, and they're certainly welcome to use the product and let me know how it goes. But it's certainly not something that I'm currently prescribing for my arthritic patients. So guys, in summary for today's talk, there's lots of things we've got to consider. The first and foremost is osteoarthritis is not just a disease of joints. Yes, joints get inflamed and joints hurt and you limp and you are somewhat immobile at times, but it also is a systemic disease. It affects your temperament, your appetite. Chronic stress and pain have implications on other organs, and I think we have to look at this as a whole body disease. As far as treating it, because of that, it's a multimodal treatment where we want to hopefully reduce inflammation and pain, promote healing whenever we can, but we can't do it at the expense of other organs, especially in older animals. So it's got to be multimodal. It's not just NSAIDs. We need to think heavily about, see that little joke, think heavily about weight loss. We want to maintain activity. We want to actually increase activity anytime we can, as long as the patient is comfortable. We want to choose any drug therapies we give carefully. Think about the nutraceuticals and which ones reduce inflammation and pain. Use them. Use them early, especially chondroprotectants. Any of the anti-inflammatory nutraceuticals, use them early and late. As far as traditional drug therapies, again, look at ways to utilize NSAIDs to the best of your ability, but maybe if possible, not relying on them every day. Look at other therapies that we've mentioned, Gabapentins, Amantadines, for patients that require more than just an NSAID to be comfortable. Again, anti-nerve growth factor, MAB may become a very big player. We'll have to wait and see what it does. And then lastly, remember that we have all of these other non-drug, I really shouldn't call them non-traditional because they're becoming more and more traditional, but they're non-drug therapies that can also provide relief for patients with pain and inflammation. And lastly, again, just be careful with polypharmacy in cats. I would much rather treat a cat with something external that they can lay on than trying to pry their little death jaws open and stick my fingers in there. I've been bitten too many times in 35 years. I'd rather not do that again, or my clients, because as you can see, cats just say no. All right, so guys, here's the bottom line. We need to keep dogs like this. Stella here, this is a dog named Stella. We need to keep them mobile. We need to keep them interested. She lives for one thing, and that's it. If this dog develops significant arthritis, well, what's going to happen every year? She's not going to be able to do it. Stella, meet Leaf Pile. Leaf Pile, meet Stella. Go, babe. Crazy dog. Her joints definitely don't hurt. Guys, I'd like to say thank you to all of you, number one, for attending for the last 58 minutes. Susan Jenkins, who's with us from Assisi, and Nicole Westfall, I want to say special thanks for them for having me out today to speak with you. And I will turn things over. I guess one other point, if you want more information from Assisi Animal Health about how pulsed electromagnetic field therapy works and its history and things like that, you can go to their website. They have some very interesting things here about, again, how PEMF or targeted PEMF works. They've got information for veterinarians, owners, and so forth on osteoarthritis and pain relief.